If you're a breast cancer survivor looking to regain strength in your shoulders and your upper back after your surgery or radiation therapy treatment, keep watching for 3 simple exercises using a light resistance band to help you rebuild your shoulder strength safely and effectively. I'm Dr. Alex Hill. I'm a board-certified physical therapist, and I specialize in oncology and lymphedema. Make sure that you subscribe to my channel for more videos on cancer survivorship and lymphedema. Before we get started, make sure that you get clearance from your medical team before you start any new exercise program, especially during and after cancer treatment. Additionally, if you have lymphedema, make sure that you are wearing your compression sleeve or your compression garments to help manage your lymphedema, and listen to your body. If anything feels too intense or causes pain, stop immediately and consult your healthcare team. If you're just getting back into doing resistance exercises, make sure that you use the lightest resistance band. I do have a couple sets listed in the description below. Recommendations for strength training is 10 to 12 repetitions of each exercise we do, and doing them 2 to 3 times. After each of those sets, your shoulder should feel a little fatigued since we are working on building your strength. In this video, I'll show you around 10 to 12 repetitions of each exercise. You can then pause the video, rest for a minute, and then repeat it again for 2 more times. Or at the end of the entire video, just go back to the start and repeat all these exercises for a circuit. All right, let's go ahead, grab your band, and let's go. With these exercises, you can either place the resistance band around your hand like this, or you can bring it down to your forearm below the wrist. If you have it at the hand, that's going to make it a little bit more challenging. It's also going to put a bit more strain at the wrist. So if you have wrist pain or you're just starting out, it might be better to keep it down below the wrist, more at the forearm. The first exercise we're doing is a Y wall slide. So you're going to take the band around your forearms. You're going to start with just a little bit of tension between the arms. So we don't want to be all the way out here. We also don't want any tension lost, then it's just going to fall. So you're going to have it around your forearms, just above the wrists, have a little bit of tension, and you're going to bring your shoulder blades down and back. So this is the start position. Once you're in that starting position, you're going to breathe out as you slowly bring your arms up and out into a Y, and then come back down with your elbows coming down to your side. Breathe out as you reach out and up into a Y, and then come back down. The movement should be slow. You shouldn't have any pain with this. If you can't reach all the way up, that's okay. We're just starting in the range that's most comfortable for you. As you reach up, you also want to make sure that you're not extending your back too much and arching. So you can engage your lower abdominals, keep that spine neutral, and keep your core engaged as you do this exercise. But again, we're going into Y wall slides. You should be starting to feel this in the shoulders and the upper back, as well as you might even feel it up into the forearms and your triceps as you go up and down. As you do this exercise, make sure you keep your shoulders down and you're not letting them hike up to your shoulders. So that's where really setting those shoulder blades down and back really helps to make sure that you're getting the proper form with this exercise. The next exercise is going to be wall taps. So instead of being very close to the wall like we just did for the Y wall slides, we're going to be stepping back, so you almost have to reach for the wall forward. You're going to be having your fingertips or your hands on the wall. Resistance band, again, at the wrist or up at the hands for more of a challenge. And with this exercise, we're working on one arm at a time. So we're going to start with working the right arm first. You're going to keep your left hand steady and still against the wall. Engage your abdominals to help you support yourself. Keeping your shoulders down, you're going to reach up and out with the right arm. So if you imagine a clock, this would be 2 o'clock. Come back to the starting point, always keeping some tension in the band. Going out to 3 o'clock, back in, and then 4 o'clock. You're then going to switch arms. You're going to do the same thing with the other hand. So you're going to reach up and out to 10 o'clock, back to the starting point, 9 o'clock, back to the starting point, and then 8 o'clock. And so you're going to be working both arms, but one at a time. With the arm that's stabilizing and staying still while the other one's moving, you're going to feel that start to get a little bit of burning. We're working those muscles. So let's go ahead and we'll start with this exercise. So again, you're going to gently push into the wall, almost like you're pushing yourself back. Go ahead, let's take that right hand. You're going to tap up and out, and then back. Out to the side, back, and then down. Keep the right arm still, reach the left one up and out, and back. Out to the side, and back, and down and back. All right, that is repetition number 1 for both sides. Let's go ahead and do number 2. Out to the side and down. As you do this exercise, make sure you're keeping your core engaged, and also make sure that you're keeping your shoulders down. You're not reaching up with your shoulder. You're keeping the shoulder down the entire time that you're doing this exercise. This is number 3. And always keeping some tension at the band as you do this exercise. We never want to let it get loose. We want to challenge those muscles. We want to feel the burn. We want to feel those muscles working. Good. Let's keep going. Up and out, to the side, and down. Left hand, up and out, back to the middle, out to the side, and down. Reach up. Great job. Reach out and reach down. Go ahead, make sure you're keeping those arms stable. Keep that core stable. You should definitely be feeling this in those shoulders. If you need a break, that's okay. Take a break, pause the video, come back to it. If starting with those 10 to 12 repetitions is too challenging, again, that's okay. Start with where your body's telling you that you need to start at. Maybe you need to start with sets of 6. That's okay. We want good form and good quality movement versus trying to get through a lot of these and you don't have good form and you're just kind of going all over the place. So if you need to, kind of take a break, reset, keep those shoulders down and back, abdominals engaged, reach up and out to the side, and down. Up and out to the side, and down. Good. So got a couple more left. You're doing great. Up and out, reach to the side, and down. We're getting these shoulders strong. Up and out to the side, and down. Good. Make sure you're breathing with this. If you need to slow down, you can slow down. But make sure you're not holding your breath with this. Make sure that the band isn't rolling down your arm and causing too much pressure or pain. Ideally, it's lying flat like you can see with my arm here. Excellent job. All right, friends, we are on to our last exercise. This last exercise, you're facing away from the wall. We're going to be working on external rotation or rotating outwards from our shoulder. This is really working the back part of the shoulder. Also helps a lot with our posture. You don't have to do this with your back against the wall. If you feel like you need that for a little support, that's okay to do. With this exercise, you can either have the band around your forearms and your wrists like we have for the other exercises, or as you rotate out, if it comes down to your elbows like that, you can also just hold it like this, or you can hold it actually in your hands like this, whatever feels most comfortable for you to do. So when you get into the position, you're going to have your elbow at 90 degrees. Your arms aren't going to be tucked all the way in. You want a little bit of space between your elbows and your side. And we're keeping our shoulders down the whole time, so we're not letting them come up. So with this exercise, you're going to breathe out as you rotate your hands out and then back in. So we're not pulling them out to the side. We're just pivoting at the elbow that you can see here, okay? You're gonna breathe out, rotate out. Let's go ahead and we've got 1 and 2. Make sure you're breathing with this. You can also engage your abdominals and your core to help get some stability through here. Make sure you're not extending your back to get that rotation. As you pull back and you open up, at the end range here, you should really feel your shoulder blades squeezing together. Feeling the muscle burn between your shoulder blades, the back of the shoulders, really getting that strengthening going. Again, you can hold the band here or you can have it at your forearms if you're having a hard time with actually holding the resistance band. Excellent job. And those are the exercises. Great job. These 3 exercises are a great starting point to start building stronger shoulders and stability after breast cancer treatment. Remember, always listen to your body, and consistency is key. Ideally, you can try to do these exercises 2 to 3 times a week. I hope you found this video helpful. Please like it if you did, share it with someone who might benefit, and don't forget to subscribe to my channel for more videos on cancer survivorship and lymphedema management.